It's Wellness Wednesday with our friends at Leg Health. Dr. Cox, how are you?
I'm great. How are you?
We're fantastic. We are fantastic. And of course, we're with Leg Health and Wellness Wednesdays. We get together this time every Wednesday because Leg Health, we get it.
We're talking about your specialty. You are an OBGYN, obstetrics and gynecology. You are one of the types of doctors, or I don't know if it's considered a specialist, that every female is encouraged to go and see in their lifetime. You're not like, well, I might want to go see a cardio. No, you need to go see your OBGYN. Even if you are not having children, it doesn't matter. You need to go see your OBGYN.
Yeah.
Why is it so important for women to make sure they make that step to come and see you?
Well, you know, regular care is very important to optimizing your health. Seeing a gynecologist annually will ensure that you're up to date with the routine screenings, and it allows you the opportunity to ask your own personal questions and voice your concerns. The best medicine is prevention and early detection, so establishing regular care can be theoretically life-saving.
I mean, everybody should do it. Would somebody need a hysterectomy?
There are a wide variety of reasons why women undergo hysterectomies, from persistent abnormal uterine bleeding, pelvic pressure from fibroids, uterine prolapse, precursors to uterine cancer, and overt malignancy.
You guys have an alternative, and how do I find out if I'm a candidate for that?
Right. Well, that's definitely a discussion I encourage you to have with your own healthcare provider. Obviously, the uterus is what holds pregnancy, so if you
Correct.
are a woman that has not completed childbearing, or if you're a poor surgical candidate, you should definitely explore alternative options when appropriate. For instance, if you were identified with abnormal uterine bleeding, oftentimes we can manage this with birth control pills, intrauterine devices. They release a small amount of localized progesterone within the uterine cavity. Depo-Provera injections, Nexplanon, which is an implantable device that's placed within the arm. Uterine ablation is also a quick minor procedure. It's performed under anesthesia. It essentially burns the inside lining of the uterus. It's associated with a fast recovery and typically yields great reduction in vaginal bleeding. Several of these options can be used to treat ladies with uterine fibroids. However, studies do show that if bulky symptoms are present, symptoms of persistent pelvic pain, pressure with intercourse, difficulty with urination and defecation, then a hysterectomy might be your best management option.
But you know, if you are with your OBGYN and that's what they're telling you is you need to have a hysterectomy, this is not necessarily what you want.
Mm-hmm.
What do they say? They say get a second opinion. You actually are taking new patients right now.
Correct.
So if the second opinion they want is yours, they can do that.